So this is Jacqueline Wood. She started her career with working with individuals with exceptional needs in 2007 when she received her bachelor's degree in special education and master's in teaching English as a second language. In her 10 years as an educator, she's taught children from kindergarten through age 22 in New York and Florida. She's also served as a registered behavior technician for 3 years. Currently, Jackie is a clinical support specialist at the FAU Center for Autism and Related Disabilities, working with adolescents and adults with autism. Great organization, by the way. She is also currently completing her PhD in exceptional student education at FAU, focusing her studies on social and community inclusion for individuals with autism. At CARD, Jackie heads many of their safety initiatives, such as accessing the community, water safety, in-home safety support, and promoting safe interactions between individuals with autism and law enforcement officers. All right, Jackie, take it away.
All right, thank you, Anna. So I'm here today to talk about autism and special needs and some resources that we have available in the area, as well as some supports for helping individuals with special needs to learn how to swim and promote safety and minimize the risks for them. For those of you who may have attended Stacy Hoagland's presentation just before this, it's a small, we're a small, relatively small community here in South Florida with autism, and there's a lot of things that I will build on from that presentation. But as Anna said, if you have questions, please feel free to put them in the chat as we go. I'm happy to stop and take those questions, and then at the end, I'll open it up as well. But so my name is Jacqueline Wood. I work for the Florida Atlantic University Center for Autism and Related Disabilities, so FAU CARD. Just a quick overview. I'll do an introduction and just talk about CARD because there are many CARD centers around Florida, and we're available as a free resource for different organizations and individuals throughout the state. So I'd like to get our information so you have us as a resource. I will do a brief overview of autism spectrum disorder, or ASD, and then talk about some of the unique risks that individuals with autism do face when we talk about water safety, as well as ways that we can minimize those risks. And then talk about different supports and layers of safety to help individuals with autism around the water and learning to swim. I'm going to skip over that because Anna did such a nice job introducing me. So about FAU CARD. So we are a community-based program. There are 6 CARD centers around the state, and most of our major public universities have a CARD center. We split up based on counties. So FAU CARD, we have a 5-county region that I will cover, but there's a CARD center at UM, and they have a satellite center at Nova. And every county in Florida is covered by a CARD center. So every county has the support. We provide expert consulting, training, and support throughout the lifespan. So from birth through adulthood. And we provide support specifically to people with autism and select related disabilities, their families and friends, professionals who serve them and work with them, employers, and community members. So really anybody who's interested in getting supports or learning more, we are open to helping and supporting. We are a grant-funded agency through the Florida Department of Education, and all of our services are free of charge. So at FAU CARD, our specific 5-county region is Palm Beach County, Martin, St. Lucie, Indian River, and Okeechobee counties. And in South Florida, we also have UM and Nova CARD that cover Miami-Dade, Broward, and Monroe counties as well. And a lot of what we do is family and school consultations. We do a lot of trainings and workshops, mostly virtual at this point. We provide public education. So again, we're still virtual right now, but when we can get back out and get together, we like to attend different community events and be a support for other agencies and families that have somebody with autism. Much of what I do is working with families and community providers to help get connected to different resources and put supports in place so that we can appropriately support those individuals. We have a mentoring program for teens with autism. We also run social hangouts and social groups for individuals with autism. And that's just kind of the surface of what we do. But as Anna mentioned, I do run a lot of our safety initiatives in Palm Beach County. So we have a grant to put together safety boxes that cover a wide range of different safety topics for individuals and for families with autism. And so as you can see in the box here, there's icons and decals for first responders for both the car and the home. We have visual supports that families can implement in the home. We provide window and door alarms so that if a individual with their child or their adult child with autism tends to leave the home, they have that support in there. We have water watcher tags, supports from Pool Safely. The YMCA has done items for these as well. So we have a wide variety of supports that we can get to families free of charge. We also run a Project Lifesaver program, and I'll talk a little bit more about this later on, but this is a waterproof radio frequency device that individuals can wear if they are at risk for wandering or eloping because, as Stacy said, and I'll cover this too, but individuals with autism they're attracted to water. They love the water for the most part. And so when they do leave the home, there's quite a few risk factors, but water is a major one. We also do trainings with law enforcement and first responders in recognizing and communicating with individuals with autism. We help get our families connected to adaptive swim lessons. And we're also part of the Water Smart of Palm Beach County and Florida committees, as well as Safe Kids of Palm Beach County. So we try to kind of cover all of those bases. So if you have not yet clicked on the polls on the right-hand side of the screen, if you could just take a moment, I'll wait just a minute to do those. I just like to know who's in the audience and sort of the roles of everybody and your experience with autism. Okay. I'm going to see, and this is my first time using these polls in this format. So let's see if I can get the results to show. All right. Are you able to see the
results, so it looks like 7 people have responded. You have 3 water safety professionals, 3 others, and 1 swim instructor. Most everybody knows somebody with autism in their personal life. Pretty much everybody has worked with somebody with autism previously. And half know that they're familiar with autism and half know a little bit about autism. There's 1 person that's not familiar with it at all.
Excellent. Okay. Good. So kind of a variety of different roles and familiarity with autism. So hopefully this will be, there will be some good takeaways from here. So autism spectrum disorder, or ASD, is a neurodevelopmental disability. So it's a lot of our individuals with autism will experience developmental delays. So where their typical developing peers are, they are oftentimes have difficulties. They're not quite up to par in certain areas. And so the tricky part with autism is that it truly is a spectrum disorder. We have individuals with all sorts of abilities, and sometimes there are really big strengths in some areas, and then there are some extreme difficulties in other areas for a person. So it's not any kind of blanket statement that we can make about an individual with autism. Many areas of life are affected by autism, and it is a lifelong disability. So although we've come a very long way in the supports and the interventions that we have to help individuals with autism, it's not something that goes away. It's something that might not be as apparent in certain aspects of their lives or at certain times of their lives. But those levels of independence and the amount of support will vary throughout their lifespan. Sometimes when we see a big transition for an individual, so when they're in school and they have kind of this safe place and they have this routine, things are going really well, and you might not even notice that they have autism, or it's just very slight. But then if there's a big life transition, like they then go to college or they go to the workplace and their routine is different, we might see some time in there where they do need some more supports. So it's kind of this fluid piece throughout their lives. So we're seeing the number of individuals with autism being diagnosed with autism is on the rise. This number, we have currently 1 in 54 children are diagnosed with autism. Before that, we were at 1 in 58, and the numbers they've gone up since in recent years. And so we don't know exactly why that is. We don't know the exact cause of autism. So there's a lot of research into this. It could be that more individuals do have autism. It also could be that we're a lot more savvy in recognizing autism in all different ways that it presents. Currently, every 4 males to 1 female are diagnosed. So more males are diagnosed with autism. Again, there is a great deal of research on this. We do believe that females may just present a bit differently. They tend to kind of fly under the radar a little bit more. They might be a little bit more socially able to kind of just sort of blend in and almost, they'll oftentimes get all different diagnoses, and then eventually we kind of realize, okay, all of these diagnoses really fit better under that autism spectrum disorder diagnosis. We don't see really any boundaries in any race, ethnicity, culture. So it doesn't appear more in one area than the others. Signs usually appear before age of 3, and many individuals will have some other type of co-occurring condition. So they may have autism and they may have Down syndrome as well. Or they may have autism and an intellectual disability, or a sensory impairment or Tourette syndrome, or they may be diagnosed with some mental health concerns or mental illness at some point in their lives. So some common characteristics of autism. And again, we have a saying in the field of autism that once you've met one person with autism, you've met one person with autism, because every individual is really very unique and presents with their own set of very, very unique abilities. But some things that we commonly see with autism are difficulty using and understanding language. So being able to express themselves, their wants, their needs, their feelings, but also understanding what's being told to them, what's being said to them. Also, individuals with autism oftentimes do not pick up on our nonverbal cues, so our facial expressions, our body language. And we have about 80% of a message can be presented through body language. So imagine talking to somebody and possibly missing 80% of that message because you don't pick up on those nonverbal cues. That can cause a lot of difficulty in social situations, and just any kind of communication and interaction with somebody. Many of our individuals have difficulty using social skills and navigating social situations in a variety of different ways. They might not know how to have that back and forth conversation, or they might not pick up on other people's their reactions. Again, that nonverbal communication. And then sensory processing. So many of our individuals will have challenges with sensory processing. Some will be oversensitized or stimulated from sensory input. So the sensory input that you and I might experience throughout the day, throughout our lives, is magnified immensely through this. So I one time had a student who he would sit and just stare up at the ceiling, and wave a pencil and just kind of, I could not, for most of the day, I couldn't get his attention no matter what I did. Um, and eventually, I was working with him and I just asked him, so what what do you do when you're distracted and you're going like this? And he said, well, don't you hear that projector? And don't you hear those lights? And can't you hear the kid out in the next door? So he was getting all of this auditory information that was coming in. And so my voice was just this tiny aspect in everything else that he was receiving. Um, and that can be any of our senses. And then some of our individuals are understimulated with by sensory input, so they will seek out that deep pressure. They want to experience more sensory input. Many individuals will engage in some sort of repetitive behavior, so it could be like hand flapping. Like I said, with that little boy I taught, he would always had a pencil in his hand and wanted to just wave it in front of his eyes like this. Many will have a very special interest as well. So they kind of hone in on one topic or one thing that they really want. They want to access that all the time. They want to talk about that. They're kind of, it sort of is their thing. Many will have difficulty with changes to surroundings or routines. So they're very structured and rule bound, and routine bound. And if there are changes and they're not sure what to expect, that can be really difficult. And in some individuals, and again, not all, but we will see some challenging behaviors. So some non-functional routines, maybe compulsive behaviors, or some individuals engage in self-injurious behaviors, or will have meltdowns if they are overstimulated or overwhelmed. So when it comes to water safety, some unique risk factors for individuals with autism. So we know that individuals with autism seem to be attracted to water, and that can be any type of water. So that might be water running from the sink or dripping from the sink, a bathtub, pools, ponds, canals, lakes, the ocean. Water is a very sensory experience. And so water glistens, water has a unique smell, water feels really good on your skin. So we see that water is it tends to be that attraction for many people with autism. We have a statistic that about 50% of children with autism are prone to wandering or leaving a safe environment. Again, and Stacy mentioned this, but if you were in her presentation, but we don't, every family, I won't say every, but the majority of families that I have worked with at some point or another will say that they experienced some sort of elopement or wandering with their loved one with autism. For some, it's a habitual thing. It's a constant concern for parents because it's sort of always on. The person with autism is always ready to kind of elope to find whatever it is they want, or for whatever reason they're trying to access a different environment. For some, it might have happened once or twice and it's no longer a concern. But I've also worked with adults who have never, parents said they've never had an issue, and then for whatever reason, they've begun to start wandering from the home. I had one individual who would wander from his workplace where he didn't have 100% supervision because this wasn't a problem before. And then for about 2 months, he was leaving the workplace and he would walk. He would walk to get to the beach, and he would just walk on the beach for miles and miles until somebody could find him. So another concern is that many people with autism will lack that safety awareness. They just don't have that situational awareness to know, if I'm crossing the street, I've been taught to look for cars, but they might not, if they're thinking about something else, or they're engaged in something else, they might not be thinking about the rules for crossing the street, or they may not understand that. They might not know that I don't swim, or I can't swim, so I shouldn't go in that body of water, that canal. So that presents a big concern. Challenges with communication. So again, if they're trying to access something, they want to go outside and go swimming, but they don't know how to request that. That can be a big challenge. And again, This oftentimes when we talk about these risks, we talk about children, but it's pervasive throughout the lifespan for some individuals. Um, we do know that drowning is one of the leading causes of death among children with autism. Um, Children are 160 times more likely to experience a fatal or non-fatal drowning than their neurotypical peers, and 10% of the children who drown in Florida are children with autism. Um, and we have about 32% of parents who have reported that they have had a close call with drowning for their child. So it's a very present and real concern for our individuals with autism. So some ways to minimize this risk. So we want to identify and be mindful of any bodies of water. So if we're working with an individual with autism, we really want to be aware of all of the possible areas that could be a concern for that individual. Another big piece is if they do want to access, if there's a toy in the pool or there's something nearby and they want to access that, again, they might not know how to request that. And so they'll try to attempt to get that themselves. So being sure not to leave any items in the pool when they're not being used or near the pool where the person might try to access it. We know that swim lessons are essential, especially for children with autism. If they're drawn to water, we should provide them as young as possible. And they should also include a water safety component and a self-rescue component as well, so that if they do enter the water, they know how to be safe and to help themselves. But again, we know that adult supervision, nothing can take the place of adult supervision. Making sure that they're constantly, somebody is watching them and there's an identified person. We have those water watcher tags that person is identified as, you are responsible now for watching the water, and no distractions. Technology is down, our phones are down. We know that our 100% focus needs to be on them. If I have to go use the restroom, then I'm going to pass that on to somebody else. But making sure that we have constant supervision on our children. Also, when working with somebody with autism, we want to clarify their communication needs. So some individuals may not speak, and they might need some sort of assistive technology that supports them in speaking, or they might need visuals to help support that communication. And some individuals will be pretty expressive, but we do sometimes see that expressive ability, they might be able to, tell you their wants and their needs and talk all about something that they really love, but they have difficulty with receptive language. So they have difficulty understanding what's being told of them, directions and instructions. So oftentimes that can mask it. If I'm talking to somebody who they can tell me all of these different things, but then they're not understanding my directions, or I would expect that they can understand what it is that I'm saying. So we really want to work with parents and caregivers and people that know this individual well to figure out, okay, what works and what are those needs and where do I need to support a little bit more. Also understanding those sensory needs before interacting with that individual if possible, so that we can kind of prepare, and I'll talk a little bit more about that. Using life jackets when appropriate. So some individuals who are, they might have challenges with that texture, that feeling of the life jacket. So they might need time to really, it might start with just touch it with your finger. And then, okay, put your hand on it, practice the buckle, just getting them used to the way that feels. But sometimes it takes multiple sessions just to get them comfortable with that piece and able to tolerate that in a sensory manner. Also, a really good way, if the child or the individual has a special interest, where they have preferred items or topics that they really like, knowing that ahead of time, because that can help build rapport and help to get them to feel comfortable with you, to really want to, if we can incorporate that in anything that we do, it's going to build that motivation for them. So when we're talking about skill building and learning, we oftentimes individuals with autism are very visual learners. So the more that we can make visual in some sort of manner, the better. And again, this is where it's really crucial to talk to those people that already know the person, because not every person is a very visual learner with autism, but many are. So if they are, we want to have rules and directions that are in a format that they understand. Oftentimes that includes visuals. Um, we want to have simple and concrete wording. So less words is generally better, and very straightforward. So, even if it's just a stop sign and before I enter the pool, stop. Um, and I'll show you some examples of these. But oftentimes as well, we use stories so to sort of build the context of what they're trying to learn, so that they can understand and know what to expect and know what those rules are. And oftentimes, if we review those stories before each lesson or before they enter the pool, oftentimes our children, they learn them so well that they can repeat them without even having the story after a while. So again, putting it in a format that they can understand. Another piece to this too, though, is everything that we create for them should be both age and developmentally appropriate. So it should be in a manner that they understand, but also for our teens and our young adults or our adults that we're working with, we want to make sure that we're not using like little cartoon characters that might not be appropriate for them. We want to make sure that we kind of adapt them to be age appropriate and something that they're going to buy into and to enjoy. Some individuals will need to learn skills out of the water to really kind of master those motor movements, or to provide kind of those prompts, so that it could be a do this and it's hand over hand where we're teaching them those skills, and then we reduce back to, there's kind of these levels of prompting, but then it's just touch. Okay, do this, and teaching them that, and then kind of backing off, and then okay, do what I do this, and then sort of working back so that they can master those skills. We want to make sure that we're reviewing skills that they've already learned and reviewing what we did the last time to ensure that they're maintaining those skills, and that they remember what we've learned. And then also generalizing skills across settings. So some individuals will have a really hard time. They may be able to, in their backyard pool, they can swim from one end of the shallow end to the other side, no problem. But then when we go to the community pool or a hotel pool or just any other pool, they might not be able to take that skill from, something might be different. So maybe the steps are different. Just even getting into the pool, or the way that the side looks is different, or the interior of the pool is different, and that will be challenging for them. So we have to make sure we're promoting that these skills are practiced in different areas, and also like shallow end, deep end, all of those things. We have to make sure that they understand that what the shallow end means and the deep end. So these are just some examples of some water safety rules and directions that are really enhanced by visuals. So some of these will have, full sentences if the child is able to read those full sentences, and they can repeat or understand those rules, but they're also supported by visuals. This one is more of a story format. So you can laminate these and actually kind of put it together as a storybook. This one has longer sentences. So really depending on the levels, and generally they're going to be they're going to be individualized to the setting, maybe to the child. Laminating these and being able to have them accessible in whatever setting it is that you're in is a great way to help really all students or all learners. That is something that at CARD we do very often. We have employers come to us and say, we really need help or teachers, we need help in setting up these visuals. that's something that card can certainly help with in individualizing to the learner. Another piece, so communication boards. So some individuals may need the support of a communication board or some sort of technology that can help them to communicate. And so if they do use this type of communication, these supports, it's really easy. So if you laminate these, you can laminate them and then they'll pretty much stick to any kind of foam kickboard. So again, a really easy, fun way for them to have that right there with them during their lessons, because we want to be able to make sure that they have a way to communicate and that we're communicating clearly with them as well. Another practice that we use in the field of autism, we call them social narratives or storyboards. And so social narratives, what it does is it really puts sort of the situation into context for the individual, where they can understand and then learn some of the rules and what's appropriate, what's expected in that situation. So you can see here, and it's also each word pretty much is supported by a visual of some sort that the individual hopefully will understand and knows. But this one is for at the swimming pool. It's summer. It gets very hot outside in the summer. Sometimes I get to go to the swimming pool. Swimming pool is a big pool of water. People get in the water to cool off from the heat and have fun. So that's really contextualizing and letting that individual know sort of prepare for what is coming and understand what's going to happen. There are other pages to this one as well, so it builds on that. So once you get to the pool, this is what to expect. Again, another storyboard. So this one has a complete sentence up there for those that are able to read, but then it has the same sentence down here that's supported by visuals. So again, they can be very individualized for the individual. Social narratives and storyboards, again. So this helps to break down, this is sort of a visual for each step that they're going to do. And there are some commercial items out there that do a really good job of breaking it down by step, so they can refer to for what you're asking them to do. Another piece that we use is called a video model. And I didn't have one for a pool, but this is an example of a video model that comes from the L Center up in Jupiter. But we might make a video model of what to expect, because individuals with autism tend to be pretty structured and pretty routine bound. So doing something different out of the ordinary or doing something for the first time where they don't know what to expect can be overwhelming. So sometimes if we just create a video that shows them the environment, shows them what to expect, it can really help to ease some of that and to make it easier to participate in that experience. We also have a how-to, which will show like examples of a specific skill you might want them to do. I'm going to play this as an example. And again, this is not for the pool, but it's very easy. We've done this for equestrian therapy. We've done this in all different settings.
Okay, so we don't hear any audio, Jackie, from the video. And it could be because when you signed on, there's a little box that says like share audio. When you stop sharing your screen, if you share it again and click the audio, share audio.
Okay.
There was also a question. Denise asks, she loves the communication chart for the water lessons and the tip. Can you clarify the stick board? She may be having some audio issues.
She
said, can you clarify the stick board? So I'm not quite.
Yes.
The audio should be on the bottom left.
Situated.
When you go to share.
let's see, I have two screens, and so it just depends where I'm.
Oh, she wants to know how it sticks.
Okay, so oftentimes with it depends on the material, but oftentimes just the static between the a foam board and the laminate and with the water, it will stick right on there. If it doesn't, depending on the material, we've used tape to tape it on there. We've problem solved in different ways, but oftentimes just the static and it will cling pretty easily. But if we do need more, if the kid takes it off, we can secure it using tape or anything. Sometimes the kid will have it themselves, so we can kind of put it on there so it stays permanently. All right, I'm going to see if this doesn't work, then we don't need to go through it, or I won't use the audio, but can you hear that?
Can't hear it.
Okay, so I'm just going to kind of walk through, so the premise of this is they're doing a golf clinic for students with autism to come to. So they wanted to just sort of show, when you get there, this is what to expect. This is what it's going to look like. This is the first thing. We're going to do some stretches and kind of walks them through who's going to be there, what they're going to be doing, and just gives them a good idea. And sometimes, this was they'd already done this before. So they're using old examples from a previous event, but we can ask a peer or a sibling to come and create a video with us, just to kind of even just a walk around of, this is the environment that you're going to be in. You're going to see a diving board. You're going to see a lifeguard. This is your swim instructor. So just kind of introducing all of the different aspects of the environment so that they know what to expect. So I won't go through all of this, but video models can be a really good support for individuals. And again, we can change it to all different skills and all different settings as well. And so supporting sensory needs. So sensory, some individuals will want to get right into the water. It's going to be, they love the way that it feels and they can't wait to get into that water. Some are going to be a little bit more hesitant. Maybe the water doesn't feel as good to them, or they're nervous about it because it's something new. So we want to make sure, again, that we understand sort of those needs and can help them to feel comfortable. So oftentimes, it's helpful to have, before you're even going to get in the water, just come and see what the pool looks like if they're hesitant. Sort of this get to know you. Maybe the instructor is there and they can get to know the instructor, and the instructor might already know something that they really enjoy and can kind of engage them in that and get them excited. Depending on their comfort level with the water, again, we might have to start really slow, allowing them to become familiar with the environment, with the instructor, the things that are in that environment that they're going to see and hear. We had one little guy who was very hesitant to get in the water. And so I worked with a swim instructor to just really take it slow. We started with, he could see that we were getting water out of the pool, and we just put it in a bucket and he sat on the side of the pool, feet weren't in the water or anything, but just let him put a toy in there and let him kind of play with the water in the bucket. And then we sort of, slowly prepared him, but went a little bit further. So then he sat on the side of the pool with his feet in. And for most of the time, his feet were up. He didn't want to really touch it, but we'd get him to kind of kick. And then he thought that the splashing was really cool. So that was something that we really used to kind of motivate him. And then we said, okay, you can kick and you can splash over on the steps. And then took it just step by step to help him get comfortable with the water. We also might want to identify times where the environment's quieter. Maybe there's not as many people. It's not as visually oversensitizing. It's not as loud. And so oftentimes that's an easier environment for individuals to feel more comfortable and to learn in. And also demonstrating, if there's going to be a sensory experience that's going to be, if there's whistles or buzzers or alarms or anything that might go off, we might want to demonstrate it, or we might want to let them know, show them the whistle. This is my whistle. Um, are you ready? This is what it's going to sound like. And letting them hear it, letting them touch it, so they get comfortable with that.
You have about 5 minutes left, Jackie, just to let you know.
Okay, excellent. We're almost there. So also continuing to support sensory needs, looking at kind of the apparel that the individual might wear. Again, some items and materials might be uncomfortable. They might even be so irritating that they're painful for the individual. So if possible, some of those, being kind of lenient in what's expected from them, at least initially. And also, if they have a preferred bathing suit or something that they want to, I know some have waterproof headphones or water resistant, where they can sit on the side of the pool and use those for a little bit to get comfortable, but giving them some leniency in that if possible. And again, as I mentioned, parents might need to work ahead of time to practice wearing some of these items, just even tolerating, that feeling on their skin, whether it might be a life jacket or goggles that might, really squeeze their head and feel very funny on their face. We have to sort of build up sometimes to be able to help them tolerate that. Another piece, if you're in the pool with the individual and you're doing lessons and there's others in the pool, it's helpful to sort of turn their back to the others while we're teaching them, so that it reduces some of that stimulation and some of the input that they're getting and helps them to focus. And it's always a good idea to just identify an area in the pool area or the environment where it's sort of a quiet place, where if the individual does get overwhelmed or they just need a break from all of that sensory input, that's a place where they can go, where it's quiet. Maybe there's just like one preferred item in there that they can go and kind of relax for a minute before they continue. Building compliance. So again, working with parents and caregivers to really know what works best for this child when they're learning, or this individual. One of the biggest pieces that I can say is building rapport, understanding where their strengths are, understanding those special interests and the things that they like and they enjoy, and trying to kind of incorporate some of that, whether it's talking about it or whether it's, creating a visual schedule that has a character in it that they really like. But really building that, getting them motivated, and they want to be around you and they want to work with you, and they have fun because it's something that we're building in those enjoyments, and we're building on the strengths. So this is what you're really good at kicking. So let's kick for 5 minutes, and then I want you to try this new skill. Using timers. So again, a visual timer like this one is really helpful because this shows how much time is left. Some of our individuals will not have really any concept of time. And so saying you have 5 minutes left doesn't really mean a whole lot to them. Being predictable. So, having sort of a structure for each lesson or each time you're working with them. Oftentimes visual schedules like this can be really helpful, so they know what they're going to be doing at each time. And sometimes allowing for choices. So if you have like cards with an activity, maybe you choose 3 and then let them pick 3. Or maybe you have, okay, we're going to cover this skill, and this skill. Which one do you want to do first, to allow them to have some choice in the lesson. Another common piece that we use is called it's a first then board. So, first we're going to work on something maybe that you don't really love, but if you do that, then you get to do this thing that you really, really like to do. Oftentimes, especially if the child has used that at school or in the home, that can really help to build compliance. If they know, okay, I have to do this one thing, but then I can move on to what I want to do. Incorporating breaks, or sometimes we might need to do, if the student can only tolerate a short lesson, we might have to incorporate more lessons, but shorter in length. And then always using reinforcement. So whether that's verbal praise, giving a high five, or you did a great job um, with your work. You can, for 5 minutes, you can play with this toy on the steps. Or you did such an awesome job, you can make a big splash now. But it's important, again, understanding what works for that individual. What's reinforcing for one person with autism with one person in general isn't necessarily reinforcing for another. So we want to make sure, if we're trying to reinforce them with something that we think they like, but we don't know, it might not work the way that we had hoped. And just to kind of end it, but sometimes with, especially working with teachers and instructors, I've heard, it's a lot of work up front. Individualizing and putting all of these supports in place, and it can be some work up front. But a big piece is that if we provide those visuals and those supports for a person with autism, it's going to increase the success for all students and the safety for all learners. So this is one of my favorite cartoons, but he's shoveling the stairs, and this young man in the wheelchair says, "Could you please shovel the ramp?" And he says, "Well, all these other kids are waiting to use the stairs. When I get through shoveling them off, then I will clear the ramp for you." And this young man says, "But if you shovel the ramp, we can all get in." So just because we're helping that person who might need that accommodation or that support, but then everybody can access that as well. All right, and here are some resources. So depending on, we have a statewide card website that will help you to identify the card center that supports your area. Here's FAU Cards website, Nova Cards website, the Autism Society of Florida. I know that they do a lot on water safety. And then over here are some different certification and water safety websites.
Very great. Thank you, Jackie. Does anybody have any questions? We have about 4 minutes left. I actually do personally, Jackie, have a question for you. Because since I work at the Drowning Prevention Coalition and we offer free reduced cost swimming lessons for children with special needs, we always get questions about, how do I know that the instructor I'm going to have is qualified to teach my child with autism? So what do you recommend for parents to do in terms of seeking out a qualified instructor at a facility?
So I would recommend that parents, talk to the facility directly and see what sort of training is involved. I know every facility sort of does something different, but there are certifications that the instructor can get to be qualified for adaptive lessons. For parents too, talking about, what is the experience with the individual? What's their comfort level with working with somebody with autism? And sort of just kind of doing that due diligence. And if, as a swim facility looking for additional support, there are free training supports out there. There are certification programs that are, this one, I know the Nicholas Children's Hospital, they have a virtual program that instructors can work with. And also, relying on supports too, like supports like CARD, we can go in and help. We can't offer certification, but we can go in and help support in the environment and say, these are the supports we can put in place to help really maximize success in the supports for an individual with autism or with disabilities.
Does anybody have any questions? Any additional questions? Oh, I have another one. Jackie, with regards to the Project Lifesaver, can you discuss a little bit more about Project Lifesaver for those that may not be familiar with it?
Yes. So Project Lifesaver is it's a organization that they provide the radio frequency devices. So for individuals who are prone to wandering, they have a unique code, and they can wear the device 24/7. And so should they go missing, parents will call 911 and let them know that they have a Project Lifesaver. And so it has to be in an area that has the device and the training on the equipment. So I know in Palm Beach County, we use Project Lifesaver. And some of the counties north use Project Lifesaver. I believe Broward County uses something called Safety Net, which is similar, but it's a different program. So again, connecting with your card center, connecting with your sheriff's office, they'll be able to help let you know how to get connected with whatever program it is. But it can be, as soon as within a matter of a couple minutes, they can be out there and searching with the equipment to ensure, that the individual is found in a timely manner, or to really it increases the chances that they're going to be found in a timely manner. So no, through FAU card, we can provide for families who are financially eligible. We can provide that for free. If you go directly through Project Lifesaver, there is a fee for the equipment and then for some ongoing monitoring. But again, if there are concerns, you can contact your local card center. They can help to get you connected. If it's in Palm Beach County or any of the or Treasure Coast, we can help to get them for free. We do have.
Thank you, Jackie. Well, the main live stage is up and running now. So if people want to leave and do the wrap-up session at the stage, we really appreciate your contribution here, Jackie. Great information. Right. Take care. Bye-bye.
All right. Thank you all. Thank you, Anna. Bye-bye.